I think the future of telehealth is relatively bright. I think that the widespread adoption of telehealth during the COVID-19 pandemic has really opened the eyes of not only providers and patients to the benefit, but also to many of our insurers and our government regulatory agencies. CMS is certainly considering extending some of the relaxation of regulations beyond the public health emergency due to the pandemic. And there are a number of bills that have been introduced in Congress now, some of them rolled into a super bill that is meant to take the necessary legislative action to ensure that telehealth can be conducted more broadly in the future. There are still, though, some operational considerations and definitions of best use case that we have to come to terms with. So particularly in the world of oncology, where we rely very heavily on physical examination, we need to identify what's the appropriate interval of a telehealth visit versus an in-person visit. Which of our oncologic services are really best delivered by telehealth or more conveniently delivered by telehealth. I can think of things like survivorship, genetic counseling, where the physical components of being in the same room with the patient may not be as great. And then also the operational considerations. How do you incorporate nursing into this care? How do we ensure that we have the nursing assessment, the medication reconciliation, allergy documentation, in addition to provider visits and supportive care? That's another area that we've extended a lot of telehealth use in response to the pandemic for social work, for medical nutrition services. So will we be allowed to do that? Are these going to be recognized providers in the future? So I would sum it up by saying that the future is really going to depend on regulatory issues, legislative issues, and operational issues.